and I will be your facilitator for our hour together. And we are very happy that you all are joining us for this webinar. And we're going to be looking at this question: is early Head Start the answer? As you're planning for children and families in your state, this is a question that we're going to unpack a little bit today. So we're excited to have you all with us, and we're going to dive right in. And go to the next slide. So before we begin, I want to make sure to thank our partners from the United Parent Leaders Action Network and from Partnership for America's Children. 0 to 3 is beginning some work together on early Head Start and Head Start, and we look forward to the continued collaboration. So, okay, so here's how we're going to spend the next hour together. First, I want to take a few minutes to ground us sort of in our current context and go over a little bit of data telling us how children and families are doing right now. And then we're going to move into the more juicy part of the webinar, where you get to hear from an amazing group of panelists. And all of their names are here on the screen. And I'm actually not going to spend any time introducing them right now, because I promise you they're going to introduce themselves in a few minutes, and you're going to get to hear a lot from them. Some really great information and a great conversation that we're going to have today. So I want to move us to first taking a look at a little bit of data to see what we know about how families are doing during the COVID-19 pandemic. So first of all, the information that you're going to see over the next few slides comes from the RAPID EC data, and that stands for Rapid Assessment of Pandemic Impact on Development, Early Childhood. And this is data from a group out of the University of Oregon, and they have surveyed thousands of families over this past year, really trying to assess how families are faring during this unprecedented time that we're in. And so we're going to just sort of take a look at some of that. So one of the areas that they looked at was parent well-being. And this is not at all surprising, I think, to anyone, but it's really important to make sure that our assumptions are really backed up by the data. And what they looked at from parent well-being, what they found was, not surprising, anxiety, depression, stress levels have really increased over this past year for everyone. And again, not surprisingly, they also have found that low-income households have even higher levels of anxiety, depression, stress. And when they looked at the area of health and healthcare, again, this is not a surprise, but they had found that, because families are staying at home um, and during this pandemic, and there's a lot of hesitation about going out, families have been missing well baby checkups during this time. Uh, Vaccines have been down during this time, and again, um, these rates of missed ongoing health care are higher for low-income families. So we're starting to see a little bit of a pattern here. And in the area of employment, on the next slide, again, not surprising, we sort of know this to be true, that a large number of people, families caring for children during this time have been out of work, have decreased employment, and experiencing low income um, implications. And for low income families, that's been even worse. So higher numbers of unemployment during this time. And then again, not surprisingly, we've got higher levels of stress felt by parents, higher levels of anxiety felt by parents, higher levels of unemployment, um, and parents are sharing more concerns about their children's behavior, uh, more identifying more behavior problems in children during this time. And then another area that they looked at had to do with child care itself. And the data is showing us that the use of and access to non parental out of home care really dropped over this past year. Again, not surprisingly, as people were staying home and centers closed. Um, and then, but what they also found was that as families began to return to use of non parental care, higher income families were more likely to access that use of care than lower income families. So, again, this pattern of seeing these impacts on low income families and vulnerable families experiencing higher levels of stress on parental well being, experiencing lower attendance to ongoing health care, less availability of childcare, and higher rates of unemployment. These are the families that um, we are talking about and we're seeing in early Head Start and in Head Start. And the last little bit here around the types of childcare. Prior to COVID, half of all families were using center-based care or group care. Post-COVID, we're seeing center-based and family child care usage decreased, but unlicensed family, friend, and neighbor care increasing. And again, low-income families were the biggest group of users for unlicensed, unpaid family, friend, and neighbor care. So there's a real sort of pattern here that we're seeing for families. And again, I know this is not new information to many of you who are attending the webinar today. But we know that families are being impacted in really big ways by this pandemic. And, you know, for many, many families, even prior to the pandemic, really, these are the families who qualify for services offered by Early Head Start and Head Start, and many of whom were unable to um, receive these services. So we really want to unpack um, all of that today as we talk with our panelists. Um, so, what we'd like to do now that we've sort of oriented ourselves with an understanding of what families, and particularly low income families, are dealing with right now, we want to move into our panel discussion so we can unpack this question about Head Start and Early Head Start. But before I ask our panelists to introduce themselves, we want to hear from you. So, in the chat, tell us. What we know that many of you are familiar with Early Head Start and Head Start. So tell us, what do you value the most about Head Start and Early Head Start? We would love to hear from you about that. And while you are putting your responses in the chat and you're sharing with each other about that question, I'm going to turn to our panel so that they can introduce themselves. So let's start with um, Martin. Martin, if you can come on camera and take yourself off mute, can you introduce yourself and tell us where you're from and a little bit about your family?
Yeah, my name is Martin Juarez. I'm 32 years old. We live in Garden City, Kansas, middle of the U.S. So, um, been here, born and raised. I got four beautiful daughters, a beautiful wife. My oldest just turned 13, so she's a teenager. Then I follow with the 11-year-old, an 8-year-old, and one that just turned 2, which is my youngest. Um, Three of those kids, which would have been my 12, 8, and 2-year-old, were or are in the early Head Start or Head Start program.
Mhm.
Um, so
Mhm.
so yeah, so that's a little bit about my background, my family, and all that. So,
Okay. And your family is absolutely gorgeous. I just want to tell you that. Hopefully, everyone can see that beautiful picture of that family on the screen. Um, okay. So, and then I am going to ask Kayla to introduce herself and tell us same thing, Kayla. Where are you from? And tell us about your family, who I can hear.
Hello, my name's Kayla Desert Shore. I'm from Wilmington, Delaware. I'm a mother, single mother of two boys. I have a 4-year-old and a 10-month-old. I'm sorry, today's a snow day, so they're home with me.
Mommy,
Um,
I want hammer.
I've been in New Direction, a part of New Directions Early Head Start for about 5 years. I was a parent with my 4-year-old, and now I rejoined the program through my pregnancy with home base, and now we're in center. Now that I'm back to work from COVID and my maternity leave, I kind of had my baby at the start um, of COVID, and I love the program, everything about it, the design. I'm a part of the policy council, um, and they've been very helpful just getting me back to school, because when I first started, I didn't have a support system in my family, and I was kind of like in college. I had to drop out, but now I'm like back in school, and just throughout everything, they've been everything that I need, like helping me and helping my son. And now even with my baby, like just resources, just everything. Like I'm just so grateful.
Well, Kayla, we and Martin, we are so grateful to have you both on this call with us today. And Kayla, I know you were doing triple duty today, and we are so appreciative that even with the snow day and having your kids there with you, we love seeing them and hearing them, and are so appreciative that you are hanging with us and sharing your wisdom with us on this call. So I want to get to spend a little bit more time with both of you to talk a little bit more about um, your experience with um, with Head Start and Early Head Start. Sorry, I got a little bit distracted there for a second. Martin, I want to come back to you. Um, and have you talk a little bit more about just the um, your experience with Early Head Start and Head Start. You shared a little bit with us already, but tell us more about how you got involved and what your experience has been. And you have to come off mute, Martin.
sorry, but yeah, the reason I got involved was because I was part of the program when I was born. When my parents came here in '87 from Mexico, uh, they helped them out get the resources, being new to the town, um, and that's how I got involved. And the reason I got involved is because my mother-in-law, she's works for Head Start, and that's how we got everybody else involved in it.
Mhm.
So
Okay. So you were a Head Start. You were a Head Start child yourself.
yeah,
And then you said your mom
yeah,
taught
just
in Head Start.
no, my mother-in-law.
Your mother-in-law taught in
Yeah,
Head Start.
yeah, she would go to the homes and do the at-home learning with the kids.
And then you said three of your four children attended Head Start or Early Head Start and or Head Start. And then for the most part, you've received home visiting services,
Yeah,
correct? You were in the home visiting program?
we're in the home visiting program. My youngest now, she's at the daycare, the early Head Start daycare
hmm hmm
center. So
So she's in the center-based
yeah,
program, Aviana. Yes. Okay. And so I think one of the things, Martin, that that I've heard you say before, and talking about the importance of the program to you too is the that early Head Start and Head Start really is a child development program at its heart.
Yeah.
That early Head Start and Head Start for you has been the focus on child development and the support they've offered to your children really has been a big part of what has been the most helpful for you. Is that
Yes.
right?
Yes, yes, it definitely has. It's my thing is learning as much as you can, and the way they teach them, they give them the tools, just from the very basic stuff. I mean, it shows. It shows. My 12-year-old right now, she's smart too. And it goes down to my 11, my 8-year-old. They're all
Hmm.
very smart, and it goes back to that. Even though my 11-year-old didn't go through the program, but she did watch her older sister go through it, and she learned a lot too from that.
Hmm. Okay. So thank you, Martin and Kayla. If you can talk, I kind of want to go back to you also with that same question of what early Head Start and Head Start has meant to you in your experience.
Early Head Start has it's meant everything to me. It's like my village. I think that it's like the village that I needed on my journey in motherhood. I've learned so much, and it's helped me and my children so much that it's just like I don't know where I would be without it. It just was everything that I needed when I needed it with circumstances in life, and just parenting and just everything. Like with advocacy, I was able to do advocacy programs like advocacy training, Trolling Thunder. I participated with the policy council. I was able to go back to school. Just when COVID hit, I had a baby. I couldn't get out in the world and go grocery shopping. I had a home visitor who went. She went for me and dropped it at my door. Like just everything. It's been my village, and I'm just so grateful that me and my kids are so supported.
I hear you, and I've heard you say that a few times about the early Head Start program really being that village for you. I think another thing that I wanted to highlight for you is that um, many early Head Start programs provide services for expectant families, for pregnant women, and you started off with them with your baby when you were pregnant, and I heard you talk about the types of supports and guidance that they were able to give to you when you when you were pregnant and when you were sort of going through that experience. And I think that's a really important key to highlight for everyone on the phone that early Head Start in particular really does have that opportunity to provide services for pregnant women who need it. It is a 2-generation, sometimes 3-generation program working with parents and sometimes grandparents and their children and grandchildren. And both you and Martin really talked about or highlighted on points related to the comprehensive nature of Head Start and early Head Start. It's not just about child development and learning and care for the child. It's really about all of the services that include supports for families, includes nutrition, includes health, includes mental health and social emotional supports. So there's a full comprehensive nature to the program that you both have touched on in different ways. Um, and Kayla, do I understand that you also went to Head Start as a kid?
Yes, my mom, she was heavily involved in Head Start. I went to Head Start as a child as well.
Okay, so we've got two rock star parents here who know this program from when they were kids themselves through their parenthood. And you all have shared some really important, I think, information for us as you shared as you're sharing sort of your perspective on the use of the program. I want to pull in Katie and Tracy, who are our other panelists, to have them come in and talk a little bit about, um, from the state perspective of, um, what it takes to kind of create and bring forward a program such as Early Head Start and Head Start into your states. So let's start with Katie. Can you introduce yourself and tell us who you are, where you're from, and what it is that you do?
So my name is Katie Warren. I am with the Washington State Association of Head Start and ECAP. ECAP is our state preschool program, and it is set up very much like Head Start. It's a comprehensive approach and has a very low eligibility level. That's a whole other thing. And you know, we do a huge amount of advocacy and work with parents. We do a very intensive parent leadership program, which is a key part of our advocacy work, because the very best messenger for why Early Head Start and Head Start and those models are working is the parents who are experiencing them. And that is probably because we can't get the 4-year-olds to come to testify. I mean, if we could do that, that might be a really powerful thing as well. So one of the things that we have done over the last few years, in addition to all of the work around expanding eligibility and growing our state comprehensive preschool program, is we really surveyed the landscape and saw a real gap in 0 to 3 services for very high need families. And, you know, the feds did this too, and that's why the Early Head Start Child Care Partnerships went into place. And so we went out and got a grant from the Heart Association to work on advocacy around establishing a state Early Head Start Child Care Partnership program. It's been and the other and a couple of other things related to a better continuity of services for 0 to 3, so that they could seamlessly move from Early Head Start into our state preschool program, for example, without having to take a sabbatical, things like that. But we've been working on those kinds of issues. And what, you know, I'm just going to talk a couple of things that we have learned is there's a constant need for us to talk about the whole child and the wraparound aspects of Early Head Start and Head Start, and why those are important, because it's not something that is intuitive to lawmakers. Parents are the best and caregivers are the best messengers for that. And the other thing that we really learned is that we need to be adaptable to the way that our own state operates. So we now have a pilot in place for an Early Head Start style program. And that's because our state didn't want to just buy Early Head Start slots, even though we talked a lot about that, about how that would be the most efficient way to go about it. We got a whole big planning process involving a whole bunch of stakeholders in childcare and parents and lawmakers. And we took the parts of our state system and the parts of Early Head Start to bring together to do a comprehensive kind of program. And so I guess I'll just stop with that. I'm not sure how much time I have, so I'll just stop with that, and I can answer anything else with questions.
Great. That's really that was great, Katie. I think that was a good kind of introduction to the work that's happening in your state. And I want to bring Tracy in as well to do an introduction. And same thing, Tracy, tell us who you are, where you're from, and what you do, what's kind of happening in your state right now.
Sure. Good afternoon or good morning in some cases to everybody participating. My name is Tracy Campanini, and I'm the Deputy Secretary for the Office of Child Development and Early Learning, or we like to go by our acronym, in Pennsylvania. And related to the work that we're doing, and then I'll get to your question about what's unique about the program. In Pennsylvania, the Commonwealth initiated its pre-kindergarten state funding by expanding Head Start services back in the 90s, in 1990s. Building on the investments made by the Federal Office of Head Start, eligible grantees could expand their services. So we set the foundation for funding in Pennsylvania, utilizing Head Start as the model. As we moved into the 2000s and we encountered the opportunity to have early Head Start expansion that was occurring from the Federal Office of Head Start, the leadership at that time was really evaluating where there were communities of need for infant and toddler services and how early Head Start could fit into the continuum of services that we were already offering within our offices. And so we made application to apply to become a state grantee and were awarded that grant in the 2009 timeframe, and learned a lot of lessons because at that time, it was very familiar with a block grant approach, and becoming a grantee and having to be responsive to the expectations of being a Head Start grantee was really an opportunity for us. Continuing on that track, when the early Head Start childcare partnerships were announced, there was also a limited expansion of traditional early Head Start services. We were hearing the grantees that were funded federally that there was a lot of interest in expansion, but there was a lot of nervousness around entering into the early Head Start childcare partnership structure. And so we again sought expansion of the model, being the lead agency and then working with partners. And there were a lot of Head Start grantees who were willing to enter into partnership with us in implementation of early Head Start childcare partnerships, but there was hesitation with them being the lead agency for concern over compliance and what potential impact have on their own grant. So we have 2 grants right now, 120 slots that are federally funded for traditional home visiting services, and 368 slots, which we engage with multiple Head Start grantees in the Early Head Start Child Care Partnership, and really see that as fitting into the structure and the continuum of other services that are offered in our office. Similarly, when Pennsylvania made application for McV funds through HRSA, we wanted to allow communities to bid on the home visiting model that best met their community needs. And so in receipt of our McV grant, we also have many providers who elected to use Early Head Start as their evidence-based model and expand slots through the McV funds. So we really see Head Start and Early Head Start as being a sound part of the continuum of either offer directly or we partner to support within the Commonwealth. Why I think Early Head Start and Head Start are so unique, and I've heard this reference, is the comprehensive service model delivery strategy that we look at child development, we look at family engagement. The approach that is unique around parents having shared governance responsibility is something that I think is deeply unique to Head Start and Early Head Start. And the responsiveness to develop a model of program that meets the community needs in terms of its service delivery is also unique. Our Head Start or our Early Head Start grantees are all very individualized in how they're addressing community need, as opposed to our other pre-kindergarten programming, Pennsylvania Pre-K Counts, which is very structured in how it's delivered. And so there really is a way that both of them are complementary and support each other. My own background and the reason why I'm so passionate about Early Head Start and Head Start is 31 years ago, I started my professional career as a Head Start in the central part in a very rural area of the state. And I thought Head Start was going to be a stopping place on my way to public education. And I fell in love with it. I loved being a home visitor. And through my career, I moved into leadership in my organization and working with child development and early intervention to support enrolled families. And then I had the pleasure of serving for several years as Pennsylvania's collaboration director. So when I look at the opportunities that are afforded either with our own state systems work or future opportunities that are afforded by the Office of Head Start federally, I just think that in response to your question, in Pennsylvania, I think it is the answer.
Thank you, Tracy. I feel like also your story about how you thought Head Start was just going to be a pit stop along the way, and then 30 years later, you find yourself still there. I think that's a lot of our stories. So thank you both, because I think what you both have sort of shared is how within your states, Head Start has either been a model that you've sort of looked at, or you have pulled it in, been able to pull it in into other, along with other programs to meet families' needs. I think that one of the things that we often talk about is, we have the early Head Start and Head Start programs, but they really don't meet all of the eligible families. We're not reaching as many families across the country as certainly as the need is there. And one of the questions that often comes up that I'll pose to all of you has to do with barriers to access. I wonder if Katie, you might talk a little bit about, from your perspective, what you've seen in terms of barriers that currently exist for families to gain entry into Head Start and Early Head Start.
Yeah, so this might not be the so we are focusing on a center-based approach that requires that we dovetail with the child care subsidy system, right, to be able to operate full day, full year. And so for us here in a high cost of living state, and one that has some limitations around that subsidy system. The biggest challenge is that dovetailing of those two systems, right? Not only in terms of being able to maintain your eligibility for Working Connections childcare subsidy, but also the eligibility level of Early Head Start, which is quite low. And so in Washington, if in fact you are working almost at all, it is difficult for you to qualify for the childcare subsidy. So that's one of the biggest things that we have found. And in terms of our advocacy around that issue, it does require that you really think through all of those pieces and work with your state's system. We got them to do a longer term eligibility for our program. We got them to give higher rates, but that's not permanent. And so we're still working on that.
Mm-hmm. And certainly, I mean, COVID has thrown a monkey wrench into everything that we're all sort of working through and trying to figure out. Tracy, maybe you can talk a little bit about how COVID has impacted the need for an access to the program.
Certainly. In Pennsylvania, because of our level of community spread, many of our services have not been face-to-face or in person for a number of months. Many of our school systems are doing blended or virtual learning work. Our preschool programs, many of them are coming up with alternative strategies to support children are not coming into services. So I think as we talk about the struggles that families have, especially if they have a number of children and they're trying to manage older children's connection activity with school activities, they may be trying to juggle activities that they need to complete or engage in for their own personal work or well-being, and then trying to engage a virtual or non-in-person activities around supporting Head Start or early Head Start services, that's a lot as a family to juggle. We've certainly seen families who were previously enrolled in Head Start or early Head Start withdraw from the program right now, indicating that when COVID is resolved, they're interested in returning to the program. So we actually are experiencing enrollment decreases right now. So another piece of COVID that I'm thinking about as we move through vaccination distribution and we start to return to our program activities, we know that there are communities across the Commonwealth where the economy has essentially stalled, and that the families who are traditionally working in hospitals or working in retail at the lower level pay scale in Pennsylvania, because unlike Washington, we are one of the lowest minimum wage states still left in the United States. So without those employment opportunities, we're actually wondering how the need will be increased for that previously might have been above the eligibility threshold, may not have needed some of the supports and the considerations that are afforded through Head Start or early Head Start, and that the demand will increase because of the sluggish return and reopening of the economy once we've gotten to a place where it is safe to re-engage. And so we're putting our heads together to sort of analyze which communities across the Commonwealth may be more vulnerable and might have additional needs for us to assess.
Mhm. Yeah, that makes so much sense. And it's so hard to sort of predict what's coming. And so all of that, trying to look ahead makes a lot of sense. Go ahead, Tracy. You had something else you
Well,
wanted
I
to
was
add?
just going to say, Pennsylvania, and I'm sure that many listening on the session today or in similar states, we have a large, very rural geographic center of our state. And even for families who are willing to engage and have some access to technology, Pennsylvania's broadband isn't available for community. And I just wanted to add that as another barrier to operating and trying to support families in the time of COVID, when so many other more urban, suburban areas can depend on virtual connections. In many cases, I know our more rural programs are still working on phone calls and dropping materials off in a safe way to transfer information, which is also a complication when we think about how we're supporting families in this time for enrollment.
Absolutely. And I will say I'll put my other old hat on of a TA provider for the folks who are on the call too. I would say to check out the Office of Head Start's website, the ECLKC, because there are a number of resources that were developed to try to support programs that are sort of trying to think about and plan for and struggle with the response to COVID with families. So I would look there for some additional resources. And I want to ask Kayla if you can talk now. That I know that you said too at one point that you were seeing issues related to COVID and families not being as aware of the program because people are not coming in to centers. Can you just say a few words about what you were thinking with regards to the impact of COVID?
Absolutely. I definitely agree. And my state is having some of the same challenges that Miss Tracy highlighted, but as well, like even me going back to work and being a parent, it's a barrier now that we as parents can't go in the centers, but they take our children at the door. So that's one barrier. If a parent may have trust issues, they want to see the actual center. You can't physically go tour. You have to do a Zoom tour. That limits like our enrollment. Some parents with COVID and the fear, they're just not ready or willing, to enroll and bring their children out. Or another thing I noticed as well is that we can't do our community component of having social gatherings and get out there in the community because there's restrictions like the 6 feet and the amount of people. So that's another barrier where it's affecting like our numbers and all centered around just COVID.
Yeah, yeah. Yeah, there's so many, COVID has impacted us in so many ways. But thank you for sharing that perspective, Kayla. I want to push us forward to another question, and before we have an opportunity to take a few questions from the audience as well. And so we talked about barriers to access. Let's talk a little bit about ways to expand access to Head Start and Early Head Start. And we're working our way towards answering this question fully, if it is the answer. So Katie, I wonder if you could talk a little bit about advocating for expansion and improvement of Early Head Start and Head Start in your state. Can you talk about why and what messaging you found to be most useful?
Yeah, so it's interesting that Kayla just talked a little bit about her experience with COVID, because what we are finding the most effective this year, and we are asking for expansion this year, even though we're in the midst of a pandemic, is we talk a lot about trauma-informed services, and we have really worked a lot over the last 10 years around laying the groundwork for legislators to understand racial disproportionality and ACEs. So they get a lot of education in brain science, and we work very closely with committees to include stuff like that in work sessions, so that they are so that when we come at them at a time like this, where we say, yeah, even though we have a pandemic, we want more children, and it's because everybody is going through trauma right now. They understand the implications of what that means. So in terms of messaging, that's those are our two messages this year, are around trauma and around racial disproportionality and equity. So yeah, that's the way that we have approached it. And I would not say that we are the absolute most successful state in the whole country for expanding our state pre-K program. Since I started about 12 years ago, we've probably a little more than doubled it, maybe one and a quarter, 1.5 times. But we have a commitment from the legislature to serve all the children who are eligible. We got that written into law so that every year they are required to make progress towards this goal. And that was a negotiation to get that written into law and to actually get the legislators on the hook so that it becomes part of the sort of baseline budget that they're required to accomplish.
Okay, and you mentioned earlier about the work that you do to try to ensure that legislators really understand Early Head Start and Head Start. And I know you mentioned before helping them to understand the costs of the models and how that's been something that you've paid a lot of attention to. Can you just say a couple of words about that?
Yeah, so there's always, like all of you out there in the advocacy world know the trade-offs that we have to talk about between access and quality. And so you have to thread that needle. You have to talk about both at the same time. And one of the ways that we talk about that is, one, we talk about the outcomes that we get for children. And we have parents tell the story of how of the progress and the experience that they have had. But the other is that we straight up tell them how much our teachers make, which is appalling, right? So that we, when we go in, we really talk about the, sort of the state of the economy for early childhood teachers and staff. Honestly, we don't talk a whole lot about family support staff because teachers is a sexier conversation for them. They really get it when you tell them that these teachers have a BA and they're making $35,000 a year. It's appalling. So, that's probably the way that we message that the most often.
Great, thank you. So Tracy, I'm going to ask you if you can answer this in just 3 minutes. Also, the similar question around expanding access, and can you just talk a little bit about some of the intentional decisions that Pennsylvania's made to integrate Head Start and Early Head Start into the larger landscape? And you mentioned a little bit of this before, but talk a little bit more about that.
Sure. So from the Head Start perspective, it's been a bipartisan support approach from the administration to expand pre-kindergarten slots. And really our legislative members, along with the administration, really value pre-kindergarten services and the expansion of those slots we've enjoyed for many years. And so we've not been as successful talking about early Head Start. We do have a state investment in family support services, which includes expansion of the McVie funds. But that is really just at the sort of entry level expansion from our states. I believe that our legislative members are really well versed from our advocacy community, which has an approach to share their agenda from a perspective of expansion, inclusive of Head Start and our state funded pre-K, as well as home visiting. So their asks are jointly presented to the legislator and the administration. From our internal perspective, we're trying to share information and data around the unmet need for services across the Commonwealth for infants and toddlers, as well as preschoolers. And so we make that information available and talk in terms of where there would be opportunity for growth and expansion. So the strategy of hearing that unification of an external approach and being supported by the internal government, the administration's own staff team, sharing what the opportunities are, I think helps everybody be on the same page around what those funding opportunities could be. When we talk about our role in the implementation of those services, our perspective has been recognizing that there are communities where there might not be a grantee that is interested in expanding to meet the need. And so we have decided as a group in our own grant to seek expansion. It's been targeted at those communities where we know an existing grantee is not interested in expanding to meet the need that's available. And I do want to just be honest from the Pennsylvania perspective. While we've been implementing either state-funded Head Start or we've been operating as a federal grantee since 2009, there's still a question about whether or not the state should be a grantee. And so there's varying opinions around that. But from our perspective, try to be sensitive to local grantees' service areas, and to the extent possible, look to them to be partners in implementation around those services if and when we receive expansion. And so I think we're acknowledged and accepted, but not quite embraced all the time in the same way a community-based organization would be. And for people thinking about how Early Head Start or Head Start fits into their state, I just think that that's something that's worthwhile noting.
That's thank you for sharing that, Tracy. I think that's you have a perspective in Pennsylvania at being a grantee that is helpful for other states trying to decide and determine if that's something that they want to consider as they're making these choices. I'm going to actually turn to now some questions from our audience. We want to make sure that we have some time to answer questions as they come forward. And the first question that I see is from Cecilia. And this is for both Katie and Tracy. She says both panelists talked about state of funding funding early Head Start like programs rather than purchasing more early Head Start slots. What is the benefit of that approach? Katie, do you want to go first?
Well, so my experience with legislators is that they know what they know, and they think that they know a lot better than the feds. And there's especially, I would say, with Republican lawmakers, they are more likely to support a homegrown approach than they are to just wholesale buy into a federal program that they don't necessarily trust. So that's I still think it's more efficient and better to just buy the early Head Start slots, but I want to be able to serve more children. So, sometimes you just have to work with what you have. And that process of bringing together all those different stakeholders creates buy-in into the approach and into the advocacy around it. One thing about our approach being a center-based program is that we really talked with our other partners in home visiting and other things, and figured out where the gaps in our services were in Washington State. And we have a really robust home visiting system here. And so, and we also didn't want to be to cause any issues with their advocacy. And so one of the reasons why we are doing this is because of our overall coalition work and being able to focus on where the gaps are and the need.
Mhm. Okay, and
from
then
Pennsylvania's perspective, I just wanted to clarify, we actually do fund through grants. We don't purchase slot award funds through a competitive grant process to existing Head Start agencies. So in Pennsylvania, we currently fund 7,790 Head Starts through state funds. We have a separate pre-kindergarten program that does not have the comprehensive nature of Head Start structured into it. It's much more, it leans much more child development education in its design, known as Pennsylvania Pre-K Counts. But between the two of them, the idea is in a continuum of services and recognizing families' needs, they work together to address families in Pennsylvania. And we have sought expansion and value early Head Start through the McVie funding or through our own applications to the Office of Head Start. So when we receive that funding, we want to be responsive to the target community needs and being able to utilize it effectively.
The one other thing I wanted to mention is that when we decided to be more flexible about this, we were able to expand eligibility beyond early Head Start levels. So because of our cost of living here, we were able to take on the state eligibility level rather than the federal eligibility level for the program. And so more families could be served.
great. Thank you both. I was trying to scroll through as you were talking the chat to see if I see any other questions for the panel. And I'm not thinking that I'm seeing any that are specific for the panel. So that's okay, because there's more that I want you all to share. I'm going to actually ask you to each talk a little bit about from our final question, so we can hear a little bit more about just your own personal thoughts about Head Start and early Head Start, because we haven't come to the full answer yet. We've sort of talked around the answer of, is early Head Start and Head Start the answer? And so I want us to come to a place where we've got a full answer on this. So I'm going to actually start with you, Martin. Can you just tell us a little bit more about what you want people to know about how early Head Start and Head Start has served the community from your perspective?
From my perspective, it's helped not just the kids but the parents. Kind of like shooting that um, they gave a lot of resources for, especially for new parents. I know when I first kid, I was involved with this ABC program that I was a new parent. You know, they kind of walked us through what to expect, and then from there she went into that early Head Start program. But they give so much resources that parents think there's no help out there. Even before this COVID, I mean, for a new parent, it could be overwhelming. Um, they'll think they're by themselves, but they're not. I mean, there's, I've helped out other parents that are within the program. Uh, we're just one big family, and we're there to back each other up for anything, because they're there for their kids. I'm there for my kids, and we're all there together. So
Thank you. I love the way you talk about your experience in the program, because we can talk about early Head Start funding, and decisions about states making decisions with legislators, and Martin, you bring it back to this is about creating an opportunity for parents and their children to have the best start together that they can. And you've talked really passionately about what Head Start has done for your children in helping to shape their minds. Can you just say another sentence about that?
yeah, I mean, it has shaped their minds. Again, it's also shaped my mind too. I mean, I've learned much through them. Not just as a child when I was there, but as a parent. There's so much. I mean, I'm trying to put the words together, but I can't. Sorry, but so
That's okay. That was great. Thank you. And Kayla, really quickly, because I see now we're starting to run out of time. Really quickly, tell us
Okay.
one thing that you want people to know about Head Start, early Head Start.
I really just have to tie that it's literally like it's a village. The answer is yes. You need it in your state, like absolutely. You might not be able to serve everybody, but definitely those that you can serve, it would help, it would impact, it'll make a difference in my life. I didn't really touch on the pregnancy piece, but coming up with this COVID, I was pregnant. It was pre-COVID. I really needed a transition from I was working like full time, and I got pregnant, and that was kind of like it was an unplanned pregnancy, and then I got connected with Home Base, helped me put things in perspective. Home visitor, I needed help with prenatal care, switching services mid-pregnancy. Like I had my home visitor helped me, anything I needed. Wanted to breastfeed, help you services with free breast pump. These are services that are out there, but our normal day-to-day working, like we might not have access to or find. Like it's a support for two generational. It overall the quality is just great. It touches on child development. Like it made my pregnancy easier. I didn't have to stress like prenatal care. Anything that I needed, if I needed a pack and play, there might be like a resource, like I could connect with like a program out there that provides pack and plays, like just not, I guess, having it all together and being I guess how do I put it, like basically just not having a village and a support system. Head Start provided that for me to give me and my children a better start. So
I
I
love
just
it.
really want to touch on that.
I love it. I love it. Thank you so much, Caleb. I mean, again, you just made it real. Both you and Martin have made it real, what the program means. And I know that we are out of time. And Katie and Tracy, I want to give you one sentence to share about what you want to say, what you want people to know about early Head Start. Katie.
So my my last thing is that one of the things that we really value in Head Start and Early Head Start is the parent engagement and the whole child approach. And so in terms of our advocacy, it can't be strictly Head Start and Early Head Start. It is getting those kinds of supports for families, whether they are in your state preschool program or your childcare programs, to make sure that children and families have what they need wherever they happen to be.
Excellent. Tracy, one sentence.
I just want to say that from both of our parents' perspective and Katie's perspective, I can't say anything different, that the level of engagement across the comprehensive support services that Head Start has is invaluable and really worth consideration in terms of your problem solving.
All right, thank you all so much. And I know that we really ran to the end here, but I want to say a couple of things to our audience before we wrap it up. The answer that I think is it could be, and think about it in terms of everything else that's going on in your state, and really give a lot of good consideration to Head Start and Early Head Start as part of the answer that you're looking for. I want to tell you all that there will be another webinar. We'd love for everyone to join us for the next webinar on February 10th on engaging families in advocacy, strategies and practices and lessons from the field. And you will find in the chat a link to 0 to 3's Early Head Start Advocacy Toolkit. Please make sure you to click on that link so that you can get the information with a ton of information and tools helpful for this group. So find that in the chat box. One last big thank you to our panelists, to Kayla and Martin and Katie and Tracy. You all are fantastic. We really appreciate it. And thank you everyone for joining us today.
Thank you for the invite.
Thanks, everyone.